Your patient, Theodore Richardson, has just presented to the ED with chest pain. Now, how do we think about taking a chest pain history from Theo? Organise your approach by categorising chest pain differentials based on the three main systems that can cause chest pain: cardiac, respiratory, and gastroenterology. Always rule out red flag conditions in any patient presenting with chest pain, no matter what. Use the 4-2-1 technique to remember the conditions that can kill a patient: 4 cardiac conditions, 2 respiratory conditions, and 1 gastro condition. Finally, don't forget these other causes of chest pain that don't fall under the main 3 systems. Download this diagnostic schema into your brain to ensure you don't miss possible differentials. There's more info and resources on the Oscar website, link in the description.
Thanks for seeing me today, Doc.
Hi Theodore, thanks for talking to me today. How can I help you?
I've got this horrible chest pain.
Where do you feel this pain?
Here, right in the center of my chest, behind my sternum.
Does the pain move anywhere?
I can feel the chest pain in my back too. It feels like it's between my shoulder blades.
What does the pain feel like?
Yeah, sharp. It's like tearing into me.
How bad is the pain out of 10?
Uh, 9 out of 10, no doubt.
When did it start?
Just at work, I was at my desk about to go on a lunch break, and then my chest started to hurt.
How long have you had it?
I've had the chest pain for an hour now.
Have you ever had this pain before?
I've never had chest pain like this before.
Has the chest pain ever stopped?
The chest pain hasn't gone away.
Did it come on suddenly or gradually?
The chest pain came on suddenly.
Does anything help with the pain?
Nothing seems to help with the chest pain.
Does anything make the pain worse?
It seems to be getting worse by itself.
What were you doing when the chest pain started?
Nothing out of the ordinary. I was just typing up balance sheets for work.
So after a few lines of talking, we have a severe 9 out of 10 tearing retrosternal chest pain that radiates to the back without any suggestive context and which is getting worse by itself since it started 1 hour ago. Theodore has never had pain like this before. Without asking any more questions, there is enough information here for me to be worried about Theo dying on me. He's developed his chest pain suddenly and recently. All of the red flag differentials are still in play. He describes severe pain in the middle of his chest, still in play. His pain radiates to his back and he describes it as tearing. Now, this is a classic description of the pain you get in an aortic dissection, but radiation to the back is also possible in tamponade and esophageal rupture. However, we can't really definitively rule out any red flag differential at this stage, so let's keep going. Have you noticed any sweating?
I haven't been sweating.
Do you feel really dizzy?
I haven't been feeling dizzy.
Have you been having any palpitations?
I don't have palpitations.
Have you had shoulder pain?
I don't have any shoulder pain.
Have you had any loss of consciousness?
I haven't fainted.
Have you felt short of breath?
I don't feel short of breath.
How many pillows do you sleep on at night?
I sleep on one pillow.
Do you have any nausea?
I haven't been feeling nauseous.
Do you have a sore throat?
I don't have a sore throat.
Have you had any fever?
I don't have a fever.
Do you have leg pain?
I don't have any leg pain.
Do you have any swelling at the ankle?
My ankles haven't been swollen, Doc.
Are you coughing?
I don't have a cough.
Any pain in your back?
Yeah, I'm getting the stabbing pain in my back too.
Have you injured yourself?
I haven't injured myself recently.
Do you have any abdominal pain?
I don't have abdominal pain.
Have you vomited?
I haven't vomited.
I've been methodical here. By using the 421 mnemonic, I've thought about the red flag conditions and clustered relevant questions together to rule them out. The next step is to inquire further about Theodore's past medical history, which will give me more clues to narrow down the differential list. Do you have any medical conditions?
I have Marfan syndrome.
Have you ever been hospitalized?
I have been to hospital before.
Do you have any cardiovascular conditions?
Not that I know of. I get checked out by one of those heart doctors every so often as well.
Have you ever been diagnosed with high cholesterol?
My doctor says my cholesterol is fine.
Any medical conditions that run in the family?
Dad had a lot of problems like raised blood pressure, diabetes, and cholesterol. He died in his 50s due to a heart attack. Other than that, there is no other noteworthy medical history in my family.
Has anyone ever had an aortic dissection in your family?
I don't know of anyone in my family having an aortic dissection.
Has anyone in your family had heart attacks?
My dad had a heart attack and died in his 50s. Rest his soul.
Has anyone in your family ever been diagnosed with a deep vein thrombosis?
There's no family history of deep vein thrombosis.
Do you drink alcohol?
I do drink alcohol.
How often do you drink alcohol?
I usually only drink on the weekends. Usually only about 4 beers on any single occasion.
Do you smoke?
On the rare occasion that I smoke socially, I might have one or so.
Do you do any exercise?
I like running, so I keep pretty active.
Given the character and onset of his chest pain and the background of Marfan syndrome, my top differential is an aortic dissection. That's how to approach a patient with chest pain. Try it out yourself. Head to Oscar AI to take a history from our virtual patients and master the approach to chest pain.
If you like this video, check out more over here. And if you want to master clinical skills, head to Oscar.